Dr. Tanveer Aujla. I am a senior consultant with Motherhood Hospitals, Sector 48, Noida. Today we are going to discuss about the fibroids in the uterus. As many women must be aware that fibroids are growths in the uterus. They are non-cancerous, benign growths in the uterus. And when we are talking about incidence, it is rare to find fibroids in a younger age group, less than 20. But as the age grows, most of the women develop fibroids in the uterus. By the age of 50, 20 to 50% of the women must be having a fibroid or two in their uterus. And the good thing about it is mostly benign. Only 0.1 to 0.2% fibroids rarely turn malignant, and most of them, 99.8%, are benign. And when we are talking about the symptoms, they can be asymptomatic, that they do not cause any symptom, but as the size and the location of the fibroid takes importance, so some women present with symptoms. When we are talking about symptoms, the women might come to the OPD with pain during periods, heavy periods, pain during intercourse. Then she could be complaining of pelvic discomfort, heaviness in the pelvic area, or sometimes even constipation or difficulty in passing urine. And asymptomatic, she might just come with bleeding and pain, and when we get an ultrasound done or some other modalities, or we do a clinical examination, we find that uterus is larger than the normal size, and then ultrasound we can locate that it is a fibroid which is causing the symptoms. Then what are the types of fibroids? There are many types, but basically when we are talking, there are three types of fibroids. One is submucosal, which grow towards the cavity of the uterus. The ones which remain in the wall, the intramural fibroids, and subserous, which grow outside the cavity of the uterus. Mostly they grow from the fibers of the uterine wall only, and they may grow inside the wall, into the cavity, or outside the wall. The most symptomatic, the ones which cause the most problem, are the submucosal fibroids, because they encroach the cavity, they grow into the cavity, so they cause heavy periods, heavy bleeding. Sometimes it may become pedunculated, like the fibroid will grow into the cavity and it becomes attached to the wall by a stalk, so it looks like a mushroom. Similarly, it could be in the wall, or it will grow outside also. Subserous could also be a pedunculated fibroid. Or then sometimes the fibroids are located in the cervix or in the broad ligament, so that also is a type of classification. How do we diagnose? As I said, patient comes with the symptoms in the OPD, and then we get an ultrasound done, or by a clinical examination we can make out if she is having a fibroid. Treatment part depends on the size of the fibroid and the location where it is. As I said, the more into the cavity it grows, the more symptomatic it is. Sometimes large 7-8 centimeter fibroids remain asymptomatic, or they may cause pressure symptoms, like patient has difficulty in passing urine, or they are causing back pressure on the ureters, they are compressing the ureter, and patient may present it with renal pain and heaviness. And on ultrasound we see mild to moderate hydronephrosis and hydroureter of the kidney, or constipation, because the fibroid is always sitting on the rectum and causing difficulty in passing stools, and other symptoms like infertility, where especially the submucosal, or the ones which are very near the endometrial cavity, are causing distortion of the cavity and patient is unable to conceive. In infertility patients, 3 to 5% of the reasons are attributed to the fibroid. So our treatment depends on the symptoms of the patients. If it is a small fibroid, then we can try to give her hormones. Hormonal therapy can help shrink the fibroids, or there are certain injections also, gonadotropins, which can be given. Then there are certain intrauterine devices like Mirena, which can also help the fibroids to shrink over a period of time. Basically, progesterone therapy or combined estrogen and progesterone therapies help reduce the size of the fibroids, and there are other certain medicines also which can be given, like fibrostone and all, if the patient fits into the criteria for the safety of these drugs. And then if the fibroid is very big and causing severe symptom, then the method is removal of the fibroid. We can remove the fibroid in two ways. One is just removing the fibroid and preserving the uterus, which can be done by doing myomectomy, or which is a procedure we just take out the fibroid, but the uterus is ticked, and the patient can have children later if she wants to preserve her childbearing function and her uterus. Then there is a uterine artery embolization, not recommended if she's planning pregnancy, but in other women who are willing to preserve their uterus and not willing to go for a hysterectomy in multiple fibroids. In this, the uterine arteries, we embolize them, and it is a procedure done in a cath lab and by interventional radiologist. And then because the uterine arteries become blocked, the supply to the fibroids decrease. So over a period of time, the fibroids shrink. After menopause also, the fibroids shrink naturally because the hormones which are feeding the fibroids, they shrink over the period of time. So, and then there is something like high intensity frequency ultrasound, which can cause focused ultrasound radiation on the fibroid and help it shrink. But that is not very common and not available over many centers. So, and the most common surgery remains the myomectomy, where we remove the myoma, and it can be done laparoscopically or through open surgery. And if the family is complete, woman is already more than 45 years of age, and she is not willing to preserve the uterus, then the other option is hysterectomy. We take the uterus out along with the fibroids, and it can be done through laparoscope also, and it can be done as an open surgery, the traditional method only. So I think all women who have symptoms and who have heavy periods or heavy painful periods, and they just think that it is just because of age, they should come to a gynecologist, get themselves reviewed, and if it is a fibroid, then we can find ways to make you comfortable, and that's it.